I guess to start, a sincere thank you to the O'Brien Institute, to Bill and his team for this recognition. It means a lot. It means a lot because as Bill said, I did have a life and a career before I came to the university, and in that role, I felt like I was a contributing member in my community in terms of trying to do good work and making an impact. And when I got my position here at the university, particularly in the Cummings School of Medicine, I was completely terrified and intimidated because I knew that I would be surrounded by rock star statisticians and epidemiologists and nephrologists, and I was pretty sure that I would be invisible and I would be one of those people that could just put my head down and get my work done, and that hasn't been the reality at all. I'll talk a little bit more about that when I talk about the O'Brien Institute as a partner, but so this award really is very gratifying because it's, I feel, a sincere and authentic recognition of the importance of social science research in a faculty of medicine. So in terms of my work and what I do, I was in a meeting with Bill and Lynn McIntyre and Melanie Rock, and we were talking about some of the projects that I'm working on, and Bill said, Katrina, you're working on the 4 top social issues in Canada today. And I hadn't really realized that. I'd never thought of it that way, and it kind of hit me because my projects in these last couple of years have been related to the opioid crisis, chronic homelessness and housing policy, gaps in systems for Indigenous and refugee families, and so those are significant social issues. And I think I didn't realize that I was really doing that in that way, because when you do community engaged research, which is what I do, you go where the community needs you to go. And so it wasn't an intentional decision, oh my goodness, I need to do something about the opioid crisis. It was because partners in the community came to me and said, we need to do something and we need you to help us. And so that's a huge part of my work, and I'm sincerely thankful for that. And so just a couple of examples about, specifically about why I think we're able to influence social change sometimes. 2 of my projects, I was approached by the Calgary Recovery Services Task Force a couple of years ago. They've been rebranded to the Collaborative for Health and Homelessness, but they were interested. It was Calgary Police and the City and Alberta Health Services and a number of shelters and service providers who were all struggling with the same issue. They were seeing the same people in shelter, in emergency rooms, in jails, on the streets over and over again, cycling, and every time they saw them, their health outcomes were getting worse, they were getting sicker, and nothing was changing. And they said, we need to do something. And so there were 26 different organizations who came together and said, let's do a research project and let's build some evidence to take to ministers to show the urgency of this issue. And so we did that study and collaboratively created 7 recommendations that we presented to the provincial ministers of health, justice, and social and community supports. And Alberta Health stepped up with $750,000 to start to bridge gaps between homelessness and healthcare. And so that work is ongoing in the community, and it happened because of community. It did not happen because of me. It happened because they had a strong collective voice and they had some evidence to support their claims. The second example I think is particularly interesting because it's been fits and starts and ups and downs. And so the supervised consumption sites, you may know there are 7 cities in Alberta who are opening these sites, and Alberta Health requested that each of those 7 cities do a research project to assess the need to help develop the program models, where the site should be, what the services should be, staffing models, etc. And so I was, luckily I was asked to lead those projects in 3 cities, so Calgary, Red Deer, and Medicine Hat. And you probably know, hopefully you know, that Calgary does have a supervised consumption site. It came on board very quickly. There was tremendous community support to make that happen. Medicine Hat, there's so much support from City Council and police in that city to open this site that the harm reduction organization that's going to run it is actually getting a brand new space, and City Council has adapted the bylaws and the licensing arrangements to make that happen, and so it's happening in a really collaborative way. Red Deer is a very different situation where City Council is not as supportive. The mayor isn't supportive, and the Downtown Business Association is not supportive. So they're facing all kinds of roadblocks that have nothing to do with need and urgency and everything to do with political will. So I use that example because it's a good illustration of how difficult it can be to impact social change and to really highlight how important it is to do that in a collective way. So I'm sincerely thankful to my community partners for that In terms of my partnership with the O'Brien Institute, many of the things that Bill and Jamie talked about this morning in terms of support for members, I've participated in. So our Propel session, Catalyst funding, mentorship, peer review, all of those supports really create a solid foundation that enable me really to be able to go out in the community and do this great work. So I am sincerely thankful for that support, and I feel like this award really formally recognizes that partnership. So thanks very much.